Okay, so if you could just start sharing your screen and then we'll wait for our viewers to come in.
Okay. Hi, everyone, and thank you for joining our virtual dental shadowers session. We want to remind you that in order to get your hours, you will have to take a short quiz. And as long as you get 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Pascal for today's session. I'm handing the mic to you. Feel free to start whenever you want. All right. Well, welcome everyone. I am Claudie Pascal, and I am so excited to be here with all of you. I am truly honored for the opportunity, and I just want to start by just saying thank you to the Virtual Dental Shadowers team who's been putting these amazing presentations together and providing you all with this opportunity, and for seeing me fit to add to this collection of dental providers. So I'm gonna go ahead and jump in. Let me start my timer so I can make sure I stay on track. So this is my first presentation related to dentistry in terms of the care that I provide. I've done presentations before to minorities who are looking to get into dentistry and kind of sharing with them the ways to get into it. But this is my first time. So you guys bear with me if I jumble over my words, if I make mistakes or anything, because I am low-key nervous. But nonetheless, let's go ahead and get started. So background info about me. I was born and raised in Miami, Florida. My parents are from Haiti, and I went to Oakwood University for my undergraduate studies, and I got my degree in biology, graduated in 2014. I got married to the original Dr. Pascal, my husband, who is actually currently in Oral and Maxillofacial Surgery residency, and he is in his second year, which is the year that he is completing second year of medical school. So he's currently working on med school, preparing for step 1 boards and all of that. And then, so we got married back in 2015, which is the same year I started dental school, and 2019 is when I graduated from dental school. So I just had to put in some pictures of the amazing individuals who I kind of just shared with you guys. These are my parents, without whom I would not be where I am today, with God and his grace and goodness. And then my family, I honestly cannot take credit for where I am and the privilege that I have to be here. And this is my husband right here. And then this is my squad here, my parents, my siblings, my little nieces and nephews, and everyone. Only people missing from here is my family from my husband's side, who I all love very dearly as well and appreciate, and would not have made it this far without them either. So now that you guys kind of know a little bit about the start of my journey, I'm going to go ahead and jump into study tips and advice on staying motivated. So one thing that I know I've realized in my experience is that when the motivation runs out, discipline has to kick in. You are more than likely not going to stay motivated the entire journey, and that's okay. It happens in many ways in life, and that is the point where we just have to have the discipline to say, you know what, I don't feel like doing this right now. I don't want to do this, but I need to do this because I really do want to do this. And that's where you put that, kick in that self-control, have that discipline to hone in and do it. And that's going to be something that's really essential as you progress through your pre-dental and pre-doctoral journey. And even when you start working, you guys, it gets real. The struggle is real. Okay, let's put it that way. So getting into the tips that I have to share with you guys. The first, pretty much, I want to sum it all up into prime time and Pomodoro. There's a lot of things that I could share, but these are a few things that I especially want to highlight for you guys. So prime time, when I say prime time, I mean identifying when you are most sharp and alert for studying. So at one point, when I first started my dental school, like first year, for me, the morning time was my prime time. My mind was clear, focused, energy. I could comprehend the hardest of concepts. And so for that reason, I allocated my hardest subjects for those times. And the other little subjects, like for instance, studying resto, when do the teeth erupt, what is the anatomy, or doing lab work, I would save those for the end of the day when my energy and my focus and sharpness wouldn't be as sharp, but I still have to get things done. And I would do those at that time. So that's something that I found to be very essential, because if you end up using your prime time on other things that are irrelevant, you will find yourself not being as effective as you should be when it's time to really hone in on those harder concepts to grasp, such as your anatomy, your physiology, the biochemistry. So that's one tip that I have, is to find that prime time. And then when it comes to Pomodoro, so Pomodoro is a study technique that's out there where the recommendation is to allocate break times and study times. So pretty much you can go 25 minutes hard, take a break for 5 minutes, go for another 25 minutes, take a break for 5 minutes. Or you might say, I'm going to go straight for 50 minutes, take 10 minutes off. Whatever it is you find, the point is that when you break up those intense work focused times, you allow your brain to kind of reset every time you're taking that break. And it's shown to improve efficacy significantly. And it's really important because you're going to have so much studying to do, and it's going to be so easy to burn out in the process. So I highly recommend trying that technique, and to take it a step further by designating time limits for each section, for each subject. So to give an example, let's say you're going to be studying for 3 hours, right? So, and that's including the breaks. So you might have some oral path, developmental defects. You're going to study part 1 for 50 minutes. Then you're going to take a break. Then you say, okay, for the next 50 minutes, I'm going to study oral path, developmental defects, part 2. And then I'm going to do radiology for 25 minutes, and I'm going to do removable pros for 25 minutes. So detailing out your study schedule, is what I highly recommend. Don't just say, okay, I got 3 hours, let me study, and then just go with it. And you realize 2 hours into it, like, oh my goodness, I'm still on radiology. I need to do oral path. You want to systemize, like have a strategy. And even if you need to be more detailed and say, okay, radiology, I'm going to focus on the radiolucent lesions for 10 minutes because I kind of already did that. And I'm going to spend the last 15 minutes focusing on the radiopaque lesions, things of that sort. So pretty much having a system in place and using your time wisely, because you will not have a lot of time and you're going to constantly find yourself feeling like there's not enough time to do all that you have to do. In addition to that, I recommend detailed calendar/planner. That's something that was really helpful for me. And not just having it, but checking it consistently. So for me, I was checking it monthly. So what I would do is when I would get my syllabi for the quarter, I would say, okay, what are my courses? What do I have coming up this month? Do I have exams, etc.? And mind you, I put in there personal self-care, because you guys, that is important, and you need to schedule that as well. One of the things to help you stay motivated and to not burn out is to know that all that hard studying you're doing is not going to be your whole life, because you schedule time for your self-care too. So with that said, maybe you say, okay, this month I'm going to go to the beach, or this month I'm going to go to, I don't know, this paint class, whatever the case is. Schedule your personal self-care as well. And Then going on to weekly. So every week I would sit down and say, okay, what classes do I have? Do I have any quizzes? Do I have any assignments coming up? Once again, anything you're going to do weekly for the personal self-care, put it in there. If you're going to go to the gym, put it in there. You're going to go out to eat with your significant other, put it in there. Have that layout there to help keep you accountable and keep you on track and motivated. And then every single day, you guys, once again, what classes do I have today? What's my to-do list for today? Especially, what is my schedule, my study schedule? And once again, is there anything I need to add into today for some self-care? So pretty much being very intentional and diligent is my biggest advice for staying motivated, being organized and scheduling. And when it comes to some apps that I found really helpful, Notability, you guys probably heard of it, is amazing for taking notes, especially if you have an iPad. I love my iPad. That was so faithful for me. But you can also use it on your laptop. You know, everything is different now because of COVID. So please be mindful. Some of the things I might share with you was based on my experience where we had in session, where we didn't have COVID restrictions. So just keep that in mind. But nonetheless, during lectures, I would literally have my Notability recording while I'm taking notes. It would allow me to focus because as it's recording, I can make little marks or annotations to remind myself, okay, start. Let me go make sure I go back and listen to this for this point, or circle that keyword. Because then what happens is I can always backtrack and say, okay, when did I circle this? When was Dr. Such and Such talking about this point? Because I need to review this. That's one of the things I love about Notability. And then I don't know if you guys ever heard of concept mapping, but this is something that I have found very, very helpful for me in studying, especially with harder subjects. So what I'm going to do now is I'm going to just step out and show you what concept mapping looks like to explain the next part of my presentation. So concept mapping is a great way to visualize different concepts that you have to understand and put together. I am very picky, so writing it out was stressing me out because if I wanted to erase something or change it, it's already there on a paper. I can't do so, or I don't have, going back and trying to erase. It just was too much, and sometimes it's too big. And some people get big sheets of paper. They have their whole concept maps laid out in their rooms. There's different ways to do this. If you prefer writing, by all means do it. But iThoughts is an awesome program that I found, and I invested in it. And it was a great opportunity for me to organize my studying and make it more efficient. And you can have it on your iPad as well. So like I said, my bread and butter when I was studying, I used this. So here we go. I'm going to take you guys through a concept mapping idea to explain my next part. So dentistry, how does dentistry look for me? So I put the 2 in parentheses because what I would do sometimes with my concept map is this would be, let's say this is oral path. Let's say I would put oral path radiopaque lesions. So what I would do is on here, I would put 2 to remind me there's 2 specific categories. So I use this to organize my thoughts. And then after I'm done doing that, I use it to quiz myself. So I will say, okay, what are those 2 categories of blah, blah, blah? So Claudie Pascal, what's the 2 forms of dentistry that you do? Clinical and academic. And in clinical, there's 2 further subcategories. Private practice, which is a faculty office associated with my school that I have the privilege of working in as assistant professor. And then I also work at a federally qualified community clinic, healthcare center. So these are the 2 clinical settings that I work in. So when it comes to what my day looks like in my private practice setting, this is purely production for me. So I basically, what's the word I should say? Pretty much I'm paid off of the work that I do. So I don't have a set number that I have to produce to meet, as is the case in different places at your work. For example, when I used to work in a corporate practice, that was one of the stipulations, things of that sort. So right now, on average, I'm seeing 8 patients a day. Sometimes it'll be less if I feel like I need 2 hours for a patient or 3 hours for a patient, which means the other hour is going to be for just one other person. And then sometimes I have hygiene checks as well, during which I do the periodic exam for the patient while they're there to get their cleaning. And so the 2 types of patients that I typically see there are PPO and cash patients. So PPO, they have the select the select insurance plan through the low lender risk, which is the patient population that we especially see, and then we have cash patients. Toughest part of treatment planning for these individuals, I can't really think of any, because usually the insurance plan is very good. It covers their needs. And even if it doesn't, the individuals are very motivated for their care and they're willing to make the investment. And so there's no challenges that I could really think of when it comes to my patients for this private practice setting. Going over to the federally qualified healthcare center that I serve at, I usually see 10, sometimes up to 12 patients, sometimes less with no shows. And there's 3 category types of patients that I see. So what are the 3 category types? Medi-Cal patients, cash patients, which are different from the cash patients from the other clinic, because these are patients who don't have any insurance coverage, and therefore they are on a sliding fee scale because they can't afford the actual costs. So our clinic, being a community clinic, allows a sliding fee scale, which means that based on their income, they might be able to pay a reduced fee as much as just 50%, 40%, or sometimes 0% of the treatment costs. And then I have the privilege of serving patients who are living with HIV/AIDS, which I will get into that a little bit more. So, toughest part of treatment here, limited/no insurance coverage. That's category A and B patients. Typically, this is a challenge that I have for them. An ability to afford, same thing for this category. This does not apply for my patients who are recipients of the Ryan White program, because the Ryan White program covers their treatment. And so usually the main challenge that I may have with this population is just poor compliance, which is also a challenge that I have with my Medi-Cal and patients who are cash patients as well at this particular community clinic. So for the sake of time, I'm not going to go into too many details. I'm going to keep it moving. Now for the academic side of what I do, right? So here for the academic, I have the privilege of teaching the HIV/AIDS practicum/rotation that we have at our school. There's very few schools, I think only 11 schools that actually receive funding from the Ryan White program. It's a grant, and we have the privilege of providing it. And this is the same program that funds, like I said, that we've partnered with at the clinic that I work with. And so patients who are qualified for the Ryan White program, which once again have to be in a certain, economic status, they provide to have their medical, dental needs, other assistant needs taken care of for them. And so we've partnered with this program. So individuals, if they're looking for a dentist, they know they can come to my clinic because myself and another provider are available to serve them. And this is a very dear position for me. I am really grateful. And just to give you guys kind of a backdrop on what the HRSA Ryan White HIV/AIDS program is, it was established for this young man who, as you can see, lived a very short life. He was unfortunately diagnosed with HIV/AIDS back in the late 80s after he had a routine blood transfusion because he had hemophilia. And after developing symptoms, they found out he has AIDS. And then, at the time, the whole AIDS epidemic spiked up, more people having the conditions. Eventually, they found out it was caused by the virus. And as a result of him going through that, he experienced a lot of discrimination, school not wanting to let him back in, parents not wanting their children to be around him. And there was just so much stigma and negativity surrounded with this condition that many people started to not have access to care. It was very debilitating, and they could no longer work. They could no longer afford the care that they needed. So in honor of this young man, and to help provide the care and to fight this HIV/AIDS crisis, this program was developed. And 1 million people right now in the US are living with HIV/AIDS. There's about 38,000 new cases occurring every year as of the last studies, and 14% of individuals are unaware of their status. So while the program exists to direct individuals to clinics that are specifically designated for providing care for patients with HIV/AIDS, there are many patients who don't qualify for Ryan White, or they might not want to go to care there. There are very educated individuals, very financially well-off individuals who have HIV/AIDS, which means that even as a provider who's at a clinic that doesn't focus on that patient clientele, you might still see a patient who has this condition. Should you be scared? Should you deny them care? Those are the things that we seek to show our students is not the case, that they are able to treat these individuals just as they would someone who comes to them with high blood pressure or diabetes or any other condition that, if not controlled, can have effects on their treatment. So I'm going to skip over for the sake of time and kind of head back over here. I'm not going to spend too much time on here, but pretty much I teach this practicum, and right now we are heading in the direction of making it an interprofessional education experience where we're combining it with the medical to give them the exposure to this information as well, and to show them how we need to work as a team in this regard to be able to not only prevent more individuals from contracting this, but to also help provide the care that individuals who do have it are in need of. So for the sake of time, I'm going to drop this, but I hope once again, this kind of gave you guys a good overview of what content mapping looks like. Once again, this is what I would do with oral path, split it up, what are my different type of lesions, and I would once again quiz myself. And I love this software because I'm able to quiz myself this way. IPE, what are the 3 components, Claudie? And then boom, I try to say it out loud. 3 components are lectures, case studies, and patient living with HIV AIDS interview. Yes, I got it right. And that's what I would do. And you can add images, et cetera, et cetera. So that's my little spiel on iThoughts. Jumping back into my presentation. So now that we kind of talked about the clinical aspect, I'm going to go skip. I already did this. I already concept mapped it. So let's jump into some cases, okay? So dental case number 1 is related to trauma. So this is one of the first cases that I had fresh out of dental school when I was working at a corporate office. The 7-year-old male patient came to me and he said that he was playing in a swimming pool, basically swimming deep down under, and then he came out with a piece of his front tooth broken off. He didn't have any pain or bleeding from the trauma, just sensitivity to cold. There was no mobility when I checked. There was no pulp exposure, but there was blushing, which means when you looked at the cross section of the tooth, you can see that light pink, which showed that the pulp was literally just that thin layer away. So radiograph showed that the apex of the tooth, number 9, was still open. This is not the actual radiograph, but this is just an example of what the apex looks like while it's open. And that's because it was not yet fully matured. This is just a 7-year-old male patient. So if there was pulpal involvement, I would either have to do endo treatment or I would give a referral. Why? Because once again, the apex is not fully closed, which means traditional root canal treatment cannot be provided. And so giving a referral, if there was, let's say, a small pinpoint exposure and not any excessive bleeding, no sign of infection, it's possible that a pulp cap could be placed. That's very risky. Or I should say this, I can't say definitively that would be the case because factoring the time lapse between when it happened to when he came, there is definitely a possibility that there was room for infection for bacteria and foreign objects to enter. So that would still be like, only if it's like a super, super small opening would I be comfortable proceeding with just a pulp cap, which is where I would put a layer of dical, also known as calcium hydroxide, over it. And then just hopefully from there, the tooth no longer having any symptoms and needing further care. But if it was a bigger fracture with more extensive involvement of the pulp, there's 2 things that could have possibly been needed, and that's apex zoogenesis and apexification. 2 procedures that I am not qualified or wanting to do at all. That's completely endo specialists realm right there, and this is what they involve. So apex zoogenesis is pretty much where the pulp is alive, it's not infected, and you just want to stimulate for the roots to actually go ahead and close. And what's commonly used for that is MTA. You can look this up a little more. Once again, I'm not going to take too long for the sake of time. And then apexification is if the pulp is necrotic, and therefore full complete root canal treatment needs to be done. And then what is done is a artificial barrier is placed at the apex of that immature pulp to allow a sealing to occur so that the tooth can be fully obturated and sealed to complete the actual root canal treatment. And just the FYI, I got to give a shout out to my alma mater. MTA is, where is it? MTA is mineral trioxide aggregate, which was invented by Dr. Mahmoud Torabinejad, who actually used to be the department chair of the endodontic department at Loma Linda University. So that's the most common material that is used now in these treatments here for for these purposes. So once again, something you can definitely look into more. And especially if you're going into endo, definitely gonna talk about it. So here's my little images, my little fresh out of dental school treatment pictures. I didn't have no professional photos or anything, but the patient was willing to let me take pictures, and I'm glad that I did, because every now and then I can look back and see some of my first treatments that I've done. So because once again, it was blushing, no exposure, as you can see here, clean cut. I still added the base liner, the Di-Cal, to prevent sensitivity. And then I informed the patient, this has a guarded prognosis and there's a high risk that any big hits can lead to fracture of this tooth again, because look at how much composite I had to add. Yes, bonding is good, but when you have this much bonding done, it's very easy for it to break off again. And it's very risky that if it breaks off again, it might actually break off even deeper. So this patient naturally, you can see, has very big prominent front teeth, which is also what increases the chances of him having that traumatic injury. And so I warned him, warned mom, and told them in the future, later on down the line, maybe a crown maybe need to be considered for full coverage protection, just to prevent that risk of another fracture with endo involvement, etc. Okay. So next case, digital dentistry. So this is one of the treatments that I do very often in my private practice, and that is providing same-day crown deliveries through the awesome technology of digital dentistry. And this is an example of a patient who came in. As you can see, there's a caries here on number 31. Recurrent caries, secondary caries is what we call it, because he already had an existing restoration. And then he has this crown that's been on for 10 plus years. And around this area, you can see he has deep pockets, so some bone loss, but he had a lot of swelling of the gingival tissue around the area, and I could detect the overhangs on there. So I told the patient, look, the fact that you have this localized periodontal infection going on in this area, I can detect it with my Explorer and the floss that you have some overhangs. It's very possible that this is causing that accumulation of plaque, which is not ideal for hygiene and high risk for recurrent caries and things of the sort occurring under this tooth. I can't say for sure if there's anything happening here. There's a little shadow. It's completely up to you. If you want to leave this and continue with diligent hygiene, that's completely your prerogative. But if you would also like for us to replace this crown for better anatomy to allow more ideal hygiene and prevent periodontal disease and recurrent caries, we can offer you a new crown. Patient decided to go with the new crown. This is what the new crown looked after, and you can see that smooth transition there. This is the new composite restoration that I put in. And what I'm going to show you guys now is a little 2-minute video of how that crown was made. So this is CEREC. This is what it stands for: Chair-Side Economic Restoration of Aesthetic Ceramic Restorations, and then computer-aided design and computer-aided manufacturing. So this is what it looks like. This is a different case, because this all happened in different timings, but this is designing here. So we did the intraoral scan. This is the tooth now that we're just laying out the actual margins for the computer to register so that it can then fabricate the crown. And let me see if I can fast forward this. So I'll just let you guys kind of watch it. So now it's giving us the model crown, and these red points are our contacts. We're taking away the additional areas just to kind of get a better visualization. We're going to go in and add in the top just so you can see how the occlusion is going on in there, making sure that contacts is not too high. Once it's all finished, these are what the blocks look like that we will put into the machine right here. Here, the machine is basically just getting itself situated, getting ready, like, okay, where am I going to come in at? So these are the two burrs that's going to be responsible for this treatment. There's so much I can go into about CEREC designing and, different prep, what's required, because the preparation is different from what's required from your traditional metal crowns, porcelain infused to metal crowns. You have to have more thickness for that ceramic material so that it's able to be resistant to the forces. You have to make sure you have rounded finish lines, because as you can see, these two burrs are rounded edges. So if you have any any sharp lines, or if you have undercuts, meaning if instead of your crown being like this so that it can access it, if you have undercuts this way, that burr is not going to be able to get down here into this area. So there's very important techniques necessary for this, but I won't go into all of that today. I'm just kind of showing you guys the amazing technology that exists in dentistry now. CEREC crowns are becoming more and more popular because it saves time. Once again, you're able to do this the same day for the patient. To provide them with the crown. Aesthetics are beautiful. So as you can see, the block is purple, and when it's finished, the crown will also be purple. But after it's completed, you put the crown into the machine. Well, excuse me, you add the glaze and you put it into this machine, which will then glaze the crown, and then it's going to turn to that actual material, the color that you chose. And this is what it looks like. This is a little sprue that was cut off. We just cut that off, put it in, try it in, take x-rays. I don't cement this until I put this in and I've confirmed that this is actually nice and sealed. Then we go through the cementation, which is done via bonding, unlike other crowns, which is cementation. So it's completely bonded on, which is another awesome perk for hygiene. I love it. And that's a lot of what I do in my private practice setting. So now this is a case that I did in the FQHC that I work at. This is a very recent case. A patient came in to me, 32-year-old female, and she presented with this history. This is a bit of it, but it was long, a lot that she was telling me. Pretty much what she told me is, this tooth has been hurting on the bottom right side. There's a piece of skin growing by the cheek on the bottom left side where the tooth used to hurt, but doesn't hurt as much anymore. The gums are, her gums were hurting and bleeding very bad during brushing and eating. Her cancer doctor said it is probably from the chemotherapy and gave her a prescription for Pink Lady mouth rinse, which helped a little. She was diagnosed with breast cancer and she was at stage 3, getting close to stage 4, and at the same time she was diagnosed with diabetes back in October 2020. She's been doing chemotherapy and she's scheduled to have surgery, her mastectomy, next week. So from the time that she's seen me, she's supposed to have surgery the following week. And I asked her, does her doctor know that she's here to see me? She said yes, but they kind of told her pretty much it's fine for her to get a checkup, but she's most likely gonna have to actually get treatment done after her chemotherapy because the cancer treatment is kind of more important than the dental work. So I said, okay, no problem. Let's take a look and see what's going on. First thing I wanted to know was, what exactly is Pink Lady mouth rinse? Because you guys, I never heard of this before. So I did the search, and this is what it is. It includes liquid antioxide, Maalox, viscous silocaine. Another prescription that's commonly given is magic mouthwash. These are the ingredients, and these are what the ingredients are for. So what happens is, patients who are going through chemotherapy, they tend to develop symptoms like sores, mucositis, so infections of the gums, and it's very painful, very excruciating. Some people even want to stop the chemotherapy because of how bad the oral pain and the side effects are. And so what their medical doctors will do is they will provide them a prescription for a concoction that it pretty much puts together all different components such as these, and these are why they put these in to help the patient get some relief from what's going on as a result of the chemotherapy. So I was like, okay, now that I know what that is, she's doing chemotherapy. I see the long list of chemotherapy drugs. This is what she presents with. This is what's causing her pain right now on the lower right side, tooth number 19, caries involving the pulp. And then this is the tooth on the lower left side that was endo-treated, but as you can see, periapical lesion, and I don't have the intraoral picture, but she has pretty much a large piece of soft tissue growth from chronic abscess that she has been having. So basically it's just been chronic, coming and going. And she hadn't seen a dentist in years. So all of that causing this heavy local calculus that's present, in addition to the systemic chemotherapy, all of that was contributing to one of her complaints of the bad bleeding gums. So it wasn't to the point of any aggressive necrotizing gingivitis, but it was definitely severe gingivitis going on. And like I said, it was partly related to the systemic issues going on, but also because she had a lot of subgingival calculus present, supragingival calculus present, adding to this. In addition to that, I also found a caries lesion that was very concerning to me on the buccal of number 18, because my periodontal probe was going in about like 2.5 millimeters. And I was like, oh my goodness, this is probably on the verge of getting pulpal involvement. And if she's not going to be able to have, well, before I say that, previously endo treated 19. Okay, so I pretty much already said these things. So my rationale, okay, for my treatment plan. So this is me, general dentistry. I tried to make this visual for you guys so you can follow me, okay? I knew I needed to prescribe amoxicillin and chlorhexidine. I knew I needed to have these teeth extracted 19 and 30. And if possible, I wanted to get a full mouth debridement done and take care of number 18 because I was very concerned that if left any longer, it would likely progress to pulpal involvement, which would lead to more pain. The thing is, she has this upcoming surgery, and she also has been told by her medical doctor that she's probably going to have to wait quite a few weeks after her surgery until she can have dental treatment done. So immediately in my mind, I'm thinking, she already has a chronic abscess going on. She has a tooth that's on the way to having an abscess, and she has a tooth that's on the way to becoming pulpally involved. If we don't try to take care of these now, by the time she's done with her surgery and is recovered and cleared to proceed with dental care, these conditions might be far worse and give her way more issues and challenges to have to deal with during this very arduous journey to trying to combat this cancer. So I said, okay, I know I need to get my oral surgeon on board because I'm not going to do these extractions. I don't know if you guys noticed, but one of the tooth number 19, it had like 3 roots. And so for sure, I was like, I'm not going to do this, not only because it may be a complicated surgery, but also because she has significant health conditions going on, which prompts the involvement of an oral surgeon who is trained to be able to handle patients with these significant conditions that may compromise their health and require modification of their treatments or lead to complications from their treatments. So I knew I needed to talk to oral surgery. But before I talked to my oral surgeon, I was like, okay, I need to know if these extractions are going to conflict with the therapy that she's been having, the chemotherapy, and is it going to conflict with her surgery that's coming up next week? So these have to be done, period, before this surgery. Hands down, I believe this needs to be done. This cannot sit in here any longer because it will progress to be more severe. But if we do it, will it conflict with anything that she has going on? For me to find out, I had to talk to her primary care provider, which is her internal medicine doctor. So I reached out to the doctor, who basically told me, yeah, she's pretty much, as far as she knows, she's okay, but let me get the hematology oncology doctor on board because she can tell you more. So she reaches out. This is in a messaging system that we all have access to in our healthcare system. Thankfully, she was seeing all providers within our same, that's my timer, within our same point. So I'm going to try to wrap up soon. But she then gets back to me, hematology, and says, yes, patient's all clear, chemotherapy's done. You are free to prescribe the amoxicillin chlorhexidine. There should be no issues with that. And you should be able to go ahead and do those extractions if it's necessary. But let me go ahead and get the general surgeon on board. So I got the green light. I went ahead, boom, sent off the prescription for amoxicillin chlorhexidine, and boom, I contacted my oral surgeon because I pretty much know, okay, there should be no conflict. Let me talk to my oral surgeon to see if he has any other concerns that I need to find out about, since I kind of did my preliminary work to find out if there's anything else I should be aware of. While I'm waiting to hear from my oral surgeon, the hematology oncology doctor is reaching out to the general surgeon to say, hey, our patient needs to have some extractions done. Do you have anything to say or whatever, any concerns on this matter? General surgeon says, oh, let me talk to the plastic surgeon because he's going to be the one performing the reconstruction and everything. Let me find out if he has any concerns because he actually might want to delay the treatment if she needs to have extractions. And I'm like, oh, wow, okay. So waiting to hear from them. Get back word from my oral surgeon. He wants to know, is her chemotherapy complete? I talked to the hematology oncologist. He says, yes, she finished her last dose. All her lab values are back to normal. He says, great. Let me see what's her white blood cell count. I want to see that before I proceed. I'm very hesitant to proceed, being the fact that she just finished chemotherapy so recently, but I'm willing to do so because I understand the urgency of the matter, but I need to know her white blood cell count. Got the white blood cell count for him. It was within normal limits. Boom, he was like, all right, let's do it. I scheduled her for that Monday for her extractions. This just started on a Tuesday. And so I scheduled her for the following Monday. And now I'm just waiting to hear back from plastic surgeon, because right now time is already limited. I'm only at that clinic Tuesdays and Thursdays. And the next thing that I want to get done is a full mouth debridement. And I want to try to take care of that caries so it doesn't risk, there's no risk for going deeper. But I said, okay, you know what? Let me just wait on scheduling that. Let me focus on getting these extractions taken care of, and let me wait to hear from the doctor. Sure enough, the plastic surgeon says, oh, is the oral infection active? And I said, yes, it is active, and there's risk for it becoming very much more severe. And he says, oh, okay, well, you know what? Let's reschedule this mastectomy surgery to 2 weeks later. And I forgot to add on a layer. Once he found out the oral infection was active, he said, I would like to delay, but hematology oncology doc, how far out, how much further back can we push off this surgery? And then that's when she said, no more than 2 to 3 weeks. So then boom, she was rescheduled for 2 weeks later. All of that, you guys, to just show the importance of teamwork and to show why we are not just providers working on restoring teeth and smiles. Yes, that is important. It's a component, but we are also oral healthcare providers, which is a part of the patient's systemic health. What happens to the patient systemically can affect what happens orally and vice versa. So being all on one accord is so essential. And this to me was such a powerful reminder of that fact. And I'm so grateful to God that I was able to hustle as hard as I did to get all of this done for this patient. I'm going to breeze through this and wrap it up with this community service. I highly recommend you guys get into the community service aspect. It's what honestly drew me to dentistry. I do it all the time with my husband. That's what led me to make the switch to dentistry, was seeing it firsthand. So get that community service in and allow it to confirm for you what you really want to do, if you really want to do dentistry, because that matters heavily. This is actually me at the COVID clinic. We did a COVID vaccine clinic at the Drayson Center at my school, the gym, excuse me. And we've been providing it for the community, and California actually approved for dental providers to administer the vaccine. So I was able to volunteer to help provide that. So volunteering is my absolute passion. And when I went into dentistry, I told my husband, I was like, I want my career to be my way of giving, not my source of living. And he said, yes, let's do it. We're going to make our careers our ways of giving and not our sources of living. And so because of that, we started this journey of getting into this pursuit of financial freedom. I'm just going to zoom through this. That was us with our first house that we bought. This is our second property that we bought. This is our Airbnbs that we're running, because I put it in my bio how if I'm not taking care of my patients, taking care of my students, I'm taking care of my Airbnb guests or with my family. And this is just some of the things that we do on the side. And it's all because we're just pursuing that financial freedom that will allow us to have the time and money to live and give abundantly, which is what dentistry is all about for me. And I pray is all about for what it is all about for you guys who are going into this career field, because we have the privilege as oral healthcare providers to make a powerful impact in individuals' lives. And I hope that my presentation helped you to see that. And with that said, thank you for having me. I went over 2 minutes. I'm so sorry, but I'm going to go ahead and stop sharing now to allow for Q&A.
Okay, we're going to start with the Q&A. So our first question is, I do see that you attended Loma Linda. Was receiving a faith-based education vital to you? How did you navigate your faith while in dental school?
Oh my goodness, yes. That was a very instrumental part of my journey. So I as being Christian, so I knew that I wanted to be able to be in a place that would give me a foundation that would allow me to have the added component of not just the hand skills, because that's something, yeah, you could practice, you could learn how to do good preps, learn how to do all that, but that heart component is so essential. And I remember one of my providers said it, there's what you do with your hands, but there's also what you do with your ears and with your heart. And that's something that mattered a lot to me. And being at an institution that was very focused on that, especially mirroring the values that I have and how I approach individuals as a Christian and seeking to serve them as a whole. That mattered a lot to me. And that helped a lot to maintain my faith, which was, like I said, central to everything that I do. And it really supplemented that aspect for my life, because it allowed me to meet more individuals with all types of various beliefs from all across the world who, Christian or not, had a passion to serve individuals holistically. And Loma Linda really allowed me to do that. And I am so truly grateful for it.
The next question is, are the international trained dentists integrated with the national group at Loma Linda?
Great question. Yes, they are. So when they officially come on board, they're kind of doing a little, their curriculum is a little different, but I believe not too long after joining, they immediately assimilate into the same curriculum as the rest of the students. So I know that our curriculum is changing a lot to start implementing clinical work from first year, getting students onto clinic from first year, because before we didn't really get on until like the ending of second year, but really full throttle third year. Now they're getting students on there from first year, so that all 4 years they're seeing patient care. And I'm not sure how it has changed in terms of the international dental program, but I know that by the time they reach fourth year, the international dental students are pretty much considered fourth year students. So there's no divide when addressing the group. It's like fourth year dental students, which includes traditional and international dental program students. Here you are. This is what you need to know, et cetera, et cetera, et cetera. So I don't remember if it happens, how soon it happens, but it does happen, and it's happening even sooner than it was before in the past, the integration.
Our next question says, would you give a general idea how your daily schedule was as a dental student?
Oh, okay. This varies per year, and what I could give it varies per year. Every quarter was not the same, but I will say for the first 2 years it was pretty much lectures all day, and a few days out of the week, maybe 1 to 2, would be lab, and then sometimes depending on if I finished the lab work or not, I would be in lab the rest of that not the rest, but for that evening, or coming back sometime during the week to finish, but of course trying to prioritize the studying that needed to be done. And then getting into second year, more lab work was added. And then third year was fully clinic with classes, of course, and lab. But now it was like clinic during the day, classes, as well as lab for patients and lab for classes. And in fourth year, it was like mostly purely clinic and very few little basic classes. So my school actually recorded, documented my journey to use for recruitment purposes, and they gave me links to those clips of myself because they're on YouTube. And what I'll do is I'll put it on my Instagram page, not my D's of in life, because that is actually more about my hair journey. But that's how Virtual Dental Stratter was following me, because I talk about dentistry there. But I have a different page, Rich Black Doc in Love, that I'll share in there those videos that highlight my pre-dental journey, so that you can see more from there. And if you want to reach out to me, you can definitely reach out to me there to ask me more questions.
All right. So the next one is, what was the biggest struggle in dental school and how did you overcome it?
The biggest struggle in dental school for me, this is a little tough. I mean, honestly, hands down, handling the volume of information and just the load of work was very hard, because there really wasn't enough time in a day to get it all done. And so all those tips I gave you guys in the beginning about how to strategize your time was extremely essential. There were times I felt like I don't have time to sleep. I don't have time to eat. You know, I'm in lunch, I'm eating, but I'm studying, I'm doing work, things of that sort. So it's just really the hardest part is just the time demands of it all, and the energy that you honestly many times will feel like you don't have enough of. And so staying balanced through it all is so important, to not burn out, to not get discouraged. Thankfully, I had my husband, who actually, he ended up being away for my third year, and that made that year extremely hard for me. So that was one of my hardest experiences, was being away from him, because family means so much to me. But having those structured schedules really helped me to get through the challenges of the load, and then having that time with family was also very essential for me. So FaceTiming family all the time, like I showed you that first slide where I showed you everyone, I'm telling you, they really helped me to get through. So spending time with God and just remembering why I came to it and the passion God placed on my heart, and then tuning in, like connecting with my family and just having my game plan and staying disciplined, because not always was I motivated or wanting to do it. All of those things really helped me to get through those big challenges.
When do clinicals start at Loma Linda? And what are the exams like, as in exams throughout the semester, or are they only given at the end of the semester?
Okay, so like I kind of mentioned earlier, the curriculum at Loma Linda has been changing over the past few years. By the time I was graduating, I did sit on the curriculum committee during my last 2 years, and it was during the start of the discussions for the curriculum change, but I haven't actually been in person to experience them for myself. But from what I do know from the students when I talk to them, you are starting on clinic as early as first year, and that's usually with assisting with the exams and doing those things. And then by second year, you're getting more into like actually starting to do the cleanings and the exams, so that by third year, you're ready to jump into like exams and treatment and, you know, keep it going from there. So I know now with the curriculum, the goal has been to get students onto clinic as soon as first year. Like that is on your schedule. However, COVID has changed a lot of things. It has changed the dynamics of clinic. It has changed the dynamics of the schedule. So it's probably not as full throttle as it was, but that is the goal from what I know now with our curriculum. And then in terms of exams, usually, so the school is run on a quarter basis, and usually you will have midterm exams, and then you will have your end of the quarter exams. Some classes, like I know in pathology, we would have like more like an exam before midterm, and an exam after, or even an additional. Sometimes it'll be like four exams through the quarter, whereas in another course it's just 2 exams. In some courses it's just that one final exam with quizzes before that. So every course is different. The exams are administered online for the most part. Like I said, COVID has changed some of that. And then I think that pretty much answers the question, but yeah.
Someone said, I love the POMO technique. It helped me through biochem in undergrad. However, I found that I need to keep changing my session lengths while studying for the DAT, even for the same subject. Is that something that happened to you?
Can you repeat the other part about changing my session? Say it again.
I found that I need to keep changing my session lengths while studying for the DAT, even for the same subject.
Oh, yes. Yeah. So I think I understand what you're saying. So changing, like staying flexible is an absolute must. What you do for this quarter is different for the next quarter. What you do for this subject may be different from this other subject. What you do for this topic within this subject is probably going to be different from what you do for this other topic. Some might be more visual, some might be more reading, some might be more conceptual connections. So if you find out, okay, I need to spend 50 minutes on this instead of trying to get it into 25 minutes, by all means, adjust. If you feel like, you know what, let me just blitz through this for 15 minutes, take a break, and then come through again and blitz, by all means, adjust. Adjusting is so essential throughout your journey to thrive in your dental endeavors as well as in your personal life. And that's why I recommend having that planner, that schedule, and you're constantly checking and tweaking it every month, every week, every day, because it will vary. You're never going to say, oh, this is what I'm going to do for this quarter. This is what I'm going to do for this month. This is what I'm going to do for this week. It will change as the circumstances change, as the subjects change, as the needs change. It will change. So don't be afraid to change. If you have to change so that you can make sure it's most effective and efficient for you. That's what matters at the end of the day. If something's not working, don't get frustrated. Don't get discouraged. change to make it better. And when you find what works, stick with it until it doesn't work anymore, and then you change and adjust again.
The next question says, could the patient from case 1 have orthodontic work or no?
Could they have orthodontic for
I'm
what?
guessing they're saying in the future.
Oh my volume at the highest. I'm not too sure I understand what the question is intending to, like what the ortho would address. If you're saying does the restoration compromise the ortho, that's a very good question. It's possible that it can. However, it's possible that it can. I haven't ever really given thought to that or had that experience, but I think ortho should definitely be no problem, and they work it out through there with their orthodontists and things of that sort. So yeah, I don't know if I fully answered it or that question or captured it well, but yeah.
What are the drawbacks, if any, of same-day crown delivery?
The drawbacks of doing same-day crown deliveries?
Yes.
Drawbacks is, so sometimes it doesn't, so when the crown is done being nailed and I try it in, it may not sit well, and so now that adds, and if it's an issue with the scan, then we have to put time to rescan, or if it's actual prep modification that's necessary, then I have to modify the prep. That extends the time, and that may now put us in a position to where we're not finishing at the time we would want to. It may put us at risk of having to just remill again. It really, the main thing from my personal experience, honestly, is just if it doesn't go right within the time. But to be prepared for that, we always take a preliminary impression to have it ready to do a temporary crown if we can't deliver that same day. And sometimes you might have, there's issues with having an ideal environment to deliver. You know, that's usually not too much of a challenge, but if that is, that may require you bringing a patient back in again as well. So as of right now, in my experience, there's no main drawbacks that I'm aware of that I've had with same-day delivery. The only challenge has been when something goes wrong, we have to re-prep, we have to modify the prep or rescan, and it just extends the time, which usually the patient doesn't mind because they're like, I don't mind waiting extra 30 minutes because I'll get it done today as opposed to having to come back in 2 weeks or etc. Or sometimes I have to say, I'm sorry, but you are going to have to come back. And it's like, oh, okay, I was here this whole time, but whatever. It didn't happen, but it's okay. I understand. So that's the only thing I can think of for now in my little experience. So ask some more CEREC pros for sure.
Thank you. So let's have a last question. So would you ever consider specializing in the future?
No, as of right now, no. I considered specializing heavily when I first started because I just had a rough start getting into like corporate dentistry, the demands for speed. And I was like, oh my goodness, there's so much information, so many needs. I don't even know where to start. Maybe if I hone in and focus on one thing, it'll make it more manageable for me because I could just be like, this is just the one focus area I'm focused on, et cetera, et cetera. So for a quick minute, I was heavily considering going into ortho, but then I was like, that's 3 extra years, some more debt, and do I really want to do that just because I'm not too comfortable with this particular work setting and scenario? And when I thought about it and I talked to a lot of orthodontists and other people who were new in their their careers, or who also, and I asked them about their fresh out of school experiences, I realized that I don't have to specialize just because of that reason. And I also realized that even if it would have been nice to specialize, my overall goals in life, to me, I feel like it's matters more than going back to go to school again, because I honestly enjoy what I get to do as a general dentist. I love it. I love the service that I'm able to do. I love the skills that I'm able to bring out to the free clinic nonprofit setting, which was like the main thing that attracted me to it in the first place. So I was like, I still have these main things that drew me to dentistry that I can still do. So I don't necessarily need to go back and specialize. I could just start moving towards my other goals in life, which is getting myself financially set for the family that I want to have, having more time for the family that I've been away from for so long, and getting into more of the other things that I enjoy doing, like mentorship, philanthropy, and just nonprofit work. So I just found that I didn't want to, and I don't think I ever will really want to in the future.
Thank you so much. And we have a comment from a special guest. His name is Jeffery Pascal.
Oh,
and he said that just want to shout out to my wife and let her know that I'm very proud of her. Hashtag proud husband. And I gotta say, it was a really informative presentation. Thank you so much. I think it's, yeah, I think that's the time we have for today. And just to the viewers, we will be posting our quiz on our link tree. So please make sure that you do the quiz within 24 hours to get your hours locked in. Thank you so much, Dr. Pascal.
No problem. Thank you so much, everyone, for having me. Once again, feel free to reach out to me if you guys need anything else in the future. All the viewers, if there's anything I shared you want to know more about or anything I could help out with, just let me know. You see my Instagram handle and the link. And like I said, when you go to D's Love and Life, it's all about my hair. But in my bio, I put Black Doc at Rich Black Doc and Love. You can go there. I'll post up those videos soon about my journey, so you can kind of see more insight on how it was for me. And if you ever want to reach out to me, thank you guys for having me once again, for orchestrating this virtual dental shadowers. You guys are doing a phenomenal job. I pray you all the best on your endeavors. And thank you so much, babe, for the shout out. I really appreciate you and your support. I couldn't be here without you and the rest of my family and everyone. Thank you so much, everyone.